So imagine a patient walks into your office and can't move their arm. And you say, well, do you have an MRI? Do you have x-rays? Do you have imaging? And they say, yes, it's all negative. And you read the MRI report and it says normal shoulder. And yet you look at the patient and the patient can't raise their arm more than that. Now that's a head scratcher. This actually happened to me. But when Roxanne walked into my office, having had surgery scheduled for 1 month later, asking me if there's something I can do with her shoulder, I seriously was quite doubtful. So I took a look at her shoulder. We took a lengthy history exam, and I realized that at that stage of my young career, that I may have to defer to the surgeon on this one and just treat her post-surgically. But I took a chance, and I laid her on my table, and I started to dig into the musculature around the shoulder blade, mainly the teres major, teres minor, infraspinatus, and subscapularis. My fingers, as I palpated her body, led me to those muscles because that's where she screamed the most when I touched them. She barely allowed me to be able to do even a very light soft tissue work on the muscles of her shoulder blade. But the great story is this, and how it changed how I look at a lot of things in this realm, and my body doc online and my injury concept videos that you're watching right now are a reflection of my frustration with both what I learned in school, the application of those concepts into my clinical practice, and the fact that I wasn't getting the results I wanted. So to go back to Roxanne's story, I dug through the muscles of the shoulder blade and I began to gently mobilize her glenohumeral joint. That is the actual name of the joint where your humeral bone connects to your shoulder blade, glenohumeral. The glenoid fossa is a small, shallow cup region on the outside of my shoulder blade that points outwards that way. And the roundness of my humeral head sits in that cup and moves around. And some of the other videos that I'm going to show you, there's a lot of nuance to that motion. For instance, inferior translation during superior roll. But the point of this is that Roxanne was told she had a frozen shoulder. Now, 30 years ago, I never heard the term frozen shoulder. I heard shoulder injury, and I heard rotator cuff tear, and I heard bursitis, and I heard labral problems. But the concept of frozen shoulder was pretty foreign at that stage. And I've noticed over the years that more and more patients are coming in with prescriptions for therapy based on the concept of frozen shoulder. And what is a frozen shoulder? Well, mostly it's a shoulder that doesn't work. And so what I did with Roxanne is I dug through the muscles, mobilized her arm, and she came back a second visit. And she said, it feels a lot better. Thank you so much. I was able to sleep last night. Let's keep working on this. And I treated her again. Now remember, she had surgery scheduled for about a month away from the first date. This was, I believe, in September of, let's say, of 1999 or 2000, and she had surgery scheduled for October. So I had a 1 month window to effect change, or she was likely to go under the knife and have surgery. And I'm proud to say that about 3 weeks into treating her, she came in for a visit and she says, should I cancel the surgery? And I said, I don't know. And she said, well, my shoulder doesn't hurt anymore and it's starting to move a lot freer. And I said, well, if your surgeon believed that he needed to perform surgery on you, I do not want to be the one that makes that decision for you. But I could say this, perhaps you could call the surgeon's office and just delay the surgery instead of for October, for November or December, and we'd have a little bit more time to work on this. So she called the surgeon's office and she canceled the surgery. And again, a career-changing thing occurred. This story illustrates so much about what I see is wrong with our medical system, but also more specifically in the diagnosis of frozen shoulder. Having got to know Roxanne, I realized there were a few interesting variations that came about. One of them was extreme stress and sadness and loss. She had lost, within the year before her shoulder froze, she had lost her mom and her dad. Now, of course, on the intake form, when she came to see me, she circled the box that said shoulder injury. And by the way, she had blamed using a long bar of a pool sweeper. If you guys have ever vacuumed a pool, you know that the vacuum sits at the end of a very long bar. You know, most pools are often upwards of 8 to 10 feet deep, and these bars are a good 10 to 15 feet long. They're quite challenging to vacuum the bottom of a pool. So it made some sense that the shoulder injury may have occurred from her vacuuming a pool at her home. But the story about her mom and dad passing away was intriguing to me, and we did discuss that quite a bit. And she wound up crying on a number of the visits I was digging into the muscles. And it wasn't because of the pain I was eliciting in the shoulder. It was because of the sadness of the loss of her mom and dad. And there was a little birdie in my head said, what if there was some connection between psychological stress and frozen shoulder? Because keep in mind, there was nothing broken in the X-ray or the MRI, which also made me wonder, what was the surgeon going to cut into and correct when an MRI wasn't showing any tissue damage? So both of these concepts really intrigued me at that stage of my career. Long story short, Roxanne cancels the surgery, we continue along with therapy, and by February of the following year, roughly 5 months later, she had no pain and a perfect shoulder. It was really career-changing for me. It was really life-changing for Roxanne. And so I scheduled an appointment because I said to her, we need to schedule an appointment with that orthopedist. I was new to practice. I felt like this might be an amazing referral source for me to grow my business. And I thought the orthopedic surgeon would be both engaging with me and also looking at me as an ally in this world of medicine where we're trying to help patients solve these oftentimes vexing problems. Well, I went to that orthopedic office, and he never looked at me. He never asked me any questions. He looked at her file, he opened it up, he grabbed her arm, looked at a few things, gave her a cursory evaluation, and says it looks pretty good. And I couldn't walk out of that office that day. I sat off to the side, I remained quiet, I let Roxanne go through the evaluation. And before we walked out of that office, I had to turn to the doctor and say, so doc, how did I fix the shoulder? How could I have fixed this problem? And he looked at me and said, I have no idea. And this led me on my search to the doctor that you're seeing behind me here, Dr. Simon Niel-Asher. So like most of you guys are doing, I went to Google and I put in frozen shoulder. And a couple of the top sites I picked showed Dr. Simon Niel-Asher. And even better is Dr. Asher's website suggested that he felt that there was a mind-body connection between primary frozen shoulder. Let me digress for a moment. Primary frozen shoulder is a shoulder that is frozen, extremely painful, but the patients often lack any clear mechanism of injury. They have no idea why their shoulder has frozen, and they have no idea of anything that they've done that may have precipitated the shoulder injury. And so we're really left scratching our heads with this one going, how could somebody not be able to move their arm when there's nothing organically broken in the shoulder and these people don't recall? So you think, well, perhaps it's a proverbial straw on the camel's back. Maybe it's a series of things. I've had a number of patients over the years where I've considered the fact that the pool vacuuming incident slowly created tightness or tension around the shoulder joint, thereby leading to the frozen shoulder in the absence of a tear of the rotator cuff, labrum, or bursitis, the common subacromial problems, the acromial bone being here and the humeral bone being here, and a lot of problems that exist in shoulders are subacromial. But Dr. Asher's site mentioned this, and so I reached out to Dr. Asher's people, and most of them were saying to me, if I wanted to understand Dr. Asher's approach to treating frozen shoulder, I would have to sign up for his courses. And I said, well, I'm reluctant to do that because I'm already treating frozen shoulder and I've already been successful with the patient. And by this time, by the way, this isn't just after Roxanne, I had a number of other patients come in with frozen shoulder. I applied similar strategies and concepts to treating them, and they also got better. So I had amassed a bit of a clinical experience with this condition, Roxanne being one of the most profound. And I reached out to Dr. Asher because I was starving for intellectual discussion. I was excited that I had stumbled upon something quite valuable and super interesting, but I could not find anybody out in the world until I met Dr. Asher, a fantastic osteopath from England, who has not only led me to be one of the practitioners on his website, so I did study his courses, and despite feeling confident in my ability to treat this, there was something more I could learn, and so I signed up and I took the modules with Dr. Asher, and I had a wonderful experience in learning a few different new tools to apply in my office here, and also a lifelong learning experience with the Academy of Osteopathic Medicine. So credit goes to Dr. Asher, and even better is Dr. Asher was able to challenge the manual therapy approaches that I use here in my office now for treating frozen shoulder, as opposed to cortisone and some of the other more medical treatments like manipulation under anesthesia and surgical procedures to free the tight capsule. So credit goes to the man. Like I said with my other pages here on these injury concepts pages, is these are our heroes. These are the people that have done the hard work to not only elucidate the mechanisms of these injury states and these different problems, but have treatment protocols that are faster, better, and less invasive. So again, the more you know, the less you guess. Keep on learning, keep on applying these concepts. Go to the other pages here on my website, and then go over to BodyDoc Online for more in-depth analysis and more in-depth information regarding the injury process and how to treat it at home.